led by Al Freedman, and a really excellent panel. So we will take questions at the end of the panel, and also everything will be recorded and available on Global Gene's YouTube afterwards. So Al, I will pass it over to you.
Thank you, Shelby. Good afternoon, everybody, and welcome to those of you who are watching online. My name is Al Freedman. I am based now in Chicago. I am a practicing psychologist, and I specialize in supporting the needs of families affected by rare disease, supporting the mental health needs of rare disease communities, and supporting the needs of our industry partners who are trying to help our families in a meaningful way. I'm honored to be here. I'm also a father, and what really led me here to the stage and to Global Genes and to this conversation and to my professional specialization is my son Jack, who was diagnosed with spinal muscular atrophy in 1995 and given 1 year to live. Jack thankfully didn't cooperate with this prognosis, and he lived for 26 years up until October 2021. And so anything that comes out of my mouth, I learned from Professor Jack a bit more than the professors in graduate school. I'm honored to be here today to talk about the important topic of supporting your rare community's mental health. We're grateful for the level of interest based on the number of people here in the room with us, and we have an esteemed and all-star team here of panelists to discuss this issue. So we'll just go down the row and introduce ourselves, and then we'll get moving with the conversation. And thank you all for coming.
Thanks, Al. It's interesting to hear you say you're from Chicago, so that's a whole...
I now live in Chicago.
My name's Wendy. I lead what we call the patient experience team at Alexion, which is a company focused on rare disease drug development. We have some approved products in rare and ultra-rare communities and a very vast pipeline. And what I have really taken an interest in is how the kind of concept of what's needed for more support for communities has to be beyond the therapy intervention and clinical trials, but generally how do we show up and support communities more fully. So excited to be here. Thank you.
Hi, my name is Gary Ho. I am the Senior Community Director with Trend Community. We are an analytical company that analyzes online conversations, and we turn the conversations into actionable steps for our pharma partners. And beyond that, I live with gout and started a gout support group called the Gout Support Group of America in 2015. And currently we have north of 15,000 members. And I'm happy to be here.
Good afternoon, I'm Stephanie. I'm a psychotherapist and specialist counsellor with Rare Minds. So we are a UK-based non-profit specialising in supporting mental health of the rare disease community. And we do this by providing direct services, but also working towards increasing awareness for the mental health needs of the rare community and working towards hopefully changing policy as well. I came to work in this field because I myself was diagnosed with a rare condition in my mid-20s and found that I received absolutely no support for the emotional, psychological impact of being diagnosed with a rare condition and everything that comes along with it.
Hi, my name is Tom D'Amato. I work for Horizon Therapeutics in patient advocacy aligned to rare genetic diseases. I'm also a rare dad and an autoimmune patient myself who's gone through a tough diagnosis journey for my child and myself. And I'm lucky to do what I do and get to work with this community every single day. It's a perfect match, a constellation of my personal life and professional life coming together. Super passionate about mental health. You can't sit next to a family or a patient all weekend here or at disease-specific conferences and not be passionate about that. So excited to chat more. And yes, Al is an Eagles fan living in Chicago.
Thank you. Thank you for crediting me with that. I went to the Eagles game last Thursday night, and my partner Patty, because we just moved to Chicago, didn't notice when I said that Philadelphia was right on the way to San Diego, and she was too busy with the moving to catch the geography. So I got to my home game on my way here. Thank you, Tom. Thank you. We are going to organize this conversation. We could talk on this topic for days, and we have just a few minutes. So we're going to organize this conversation by talking about what we know about mental health needs of rare disease communities, and then we're going to shift to strategies and actual programs and practices to meet the needs of rare disease communities. And then we'll leave some time for some questions before we finish up. So I'm going to pose the question to our panelists. In your work, what have you learned about what we know about rare disease communities' mental health needs? You want me to call on you, or do you want to just pick it up? Who wants to start?
I'm happy to start.
Yeah. What do we know, Tom?
My colleagues know if there's a microphone, I'm happy to chat. But no, what we know is after this amazing, grueling diagnostic journey of several years, the doctor doesn't really know what's going on. You've gone through tons of physicians, whether you're a caregiver, a care partner, a patient, whatever that looks like. And then you get this disease, most of the time you can't pronounce it, you don't know what's next, and you go through in and out of the hospital. All of the rare disease journey is extremely isolating. And then you get this diagnosis and you feel very alone. By the way, this is rare and you'll probably never meet. I've never met someone with your disease, and you're probably never going to meet someone with your disease. So it truly impacts your mental health as far as being engaged in this community. You all are here for a reason, representing your own communities because you're engaged, to hopefully lift your constituencies one person at a time to get them engaged so they can get access to care, self-advocate with physicians, but also take care of themselves, take care of their sister, take care of their brother, take care of their child. So that's definitely a piece that I've learned in this journey for sure.
Thank you, Tom. Wendy, you're as an industry partner representative, what have you and your company learned about the mental health needs of the communities you're serving?
We executed a pretty high-level project, but we surveyed all of our patient advocacy groups and community stakeholders that we work with on a regular basis, which span a wide variety of different rare disease communities. And the number one topic that came back for where we needed to do better, where they needed support from industry, number one across every community, every respondent, was mental health. And so what we've tried to do is break that down, and what does that mean? And in listening to Tom's story, it's very consistent. So the saga of even seeking out a diagnosis and navigating the healthcare system is traumatic. And then there's a lot of other associated mental health experiences that become involved. And then there's a period of time where all of that kind of stops and the doing starts, taking care of the patient, figuring out what services are needed. So it's a cycle. And I don't think any of us have all the answers, but the more we can elevate the conversation and make mental health as important as all the other parts of that chronic care experience, the more successful we'll be. And I think the other thing that we've learned, and Al and I have talked about this a little bit, because each community tends to say to us, we're unique, we're different, our disease is different. And there's some truth to that. But in the mental health landscape, we hear a lot of the same concerns and challenges. And so how can we together, as a broader rare disease community, address these? And from the industry side, we're focused on drug development and clinical trials and access to therapies. How do we weave in the right support services, asking the right questions, and providing the right tools and tactics that we're able to do at the right time? And you guys all need to hold us accountable. So as you're engaging with industry partners, bring this to the table too, because we really need to be held accountable.
Thank you, Wendy. Gary, Trend Community analyzes hundreds of thousands of pieces of data posted on Facebook by rare disease community members, and as a community leader with GALT, what have you learned about the needs of rare disease communities, or GALT specifically, if you want to speak to that?
Yeah, absolutely. Thank you for the question. So 1994 was my first time experiencing a gout attack. I was 24 years old, walking across campus. and I experienced a pain in my ankle, and was told to go see a doctor. It could be gout. It runs in the family, so my dad says. I went to the doctor, and he looked at me and said, "You're way too young to have gout." And I was like, "Oh yes, Dad, you're wrong. I don't have gout. I'm good to go." And as time went on, the pain went away. But for anyone that has friends with gout, or if you know a little bit about gout, there's not a cure for gout. You need to manage the disease. It's a progressive disease. It took me, in a nutshell, it took me 16 years before a doctor gave me the time, didn't gaslight me, did a simple blood test that cost like $20, found out that confirmed what I knew for the 16 years I had gout. And by the time I was diagnosed with chronic gout. And so that was 2010 when I was diagnosed. Immediately, I was able to participate in a clinical trial, got my gout under control since 2010, haven't had a gout attack since. And in 2015, I was reminiscing, kind of thinking through my journey, and I was like, God, man, I'm so lonely and so isolated during the 16 years. And I was like, Gary, you were like so outgoing and so, just such a go-getter. And by 2010, I was on crutches, using a wheelchair, didn't want to participate in social activities. Beyond the physical pain with gout, there's a mental component. And then that's where Trend comes in. I am so blessed to be able to also work with Trend as a senior community director. And in 2021, the Gout Support Group of America invited Trend to participate in a data journey with us. We allowed them through an ethical framework to analyze our communication. Our group has north of 15,000 members. It's very active. Day in and day out, people are posting questions about gout, how they feel about gout, how they're living with gout. And we have this massive data set, and Trend was able to come in, and within the 12 months, we were able to analyze 150,000 comments, and we saw that there was a connection between proactively managing gout versus reactively managing gout, and how it affects the mental health side of the patient. We saw all that through communication. And so I am so glad we're here because, when it comes to gout, it's a funny thing. When you say gout, there's stigmas that are involved. But so also is true when you say mental health. There's also a stigma that's involved. So I'm happy to be here where the two can meet, the rare community and mental health.
Thank you, Gary. And this is where the two meet. Rare disease and mental health is where I work and where I've lived for all these years. And Stephanie's come all the way from the United Kingdom. There aren't many of us professionals who specialize in rare disease. And one of the most common questions I receive here at this meeting and anywhere else I go is, how can we find therapists who are at this intersection of rare disease and mental health? And I've searched far and wide, and I'm looking for company. And I found Stephanie's colleague, Kim Winter, listened to her podcast, and I thought I found my long-lost sister finally. Kim couldn't come, but Stephanie was able to travel all this way. And Stephanie, we've had a great time conversing and comparing notes because there aren't many of us. So I'll pose the same question to you, Stephanie. What in your work as a psychotherapist have you seen and found about the needs of rare disease communities in your work?
Thank you for asking. I think what I'm going to say probably is not going to come as a huge shock, but the reality is that mental health is such an unmet need in the rare disease community. Time and time again, research is showing that this is an area that is not receiving enough support and attention. And that's kind of how Rare Minds came about 3 years ago by our CEO and founder, Kim Winters, who also has lived experience of rare condition. And most of us on the clinical team have either our own experience or lived experience through family. that the mental and emotional impact of living with a rare condition, not just coming to terms with a diagnosis, but living with the day-to-day. And for those of you that might have attended our morning panel talking about the kind of the different types of uncertainties that we have to manage, so the sort of macro uncertainties, the bigger things that we have to contend with, how our condition will progress, what this means for our life plans, and then the more micro uncertainties, the day-to-day of how to manage the day-to-day things of getting to appointments or getting your child to appointments or to school, all of that on top of life in general, which is really a lot. So the way that we work in Rare Minds, as I said, majoritively in the UK, but also across Europe and hopefully in the US as well, is that we partner with patient organizations to create bespoke mental health services that meet their community's needs. Because I think one of the things I want to say as well is that mental health support is not one thing. It's not just about therapy. It's not just about one-to-one sitting with a psychologist or a counselor and talking about what's going on. It can be, absolutely, but that is not the only way to support mental health. So how we work with patient organizations as well is creating things like workshops, forums, opportunities for patients to come together and share. And I don't know, this is certainly a sense that I've had in conferences like today's, is there's so much value in coming together as a community and actually realizing that we're not alone in our experiences, that we're not the only ones that are dealing with these challenges, and seeing that there are others like us around, and that there is interest in meeting these unmet mental health needs.
Thank you, Stephanie. And just to add to what Stephanie said, and my other colleagues up here, I want to state the obvious. In the United States, in our country, our mental health system is broken. It's hard for people who don't have rare diseases to find mental health support and services when they need it, especially people with more complicated needs. And I hate to say that, but because I'm part of that system, but it's hard for people to get access with or without a rare disease in the United States. There has been an increased awareness of mental health across the world because of COVID, which has helped to destigmatize the need for mental health attention across the world and in our country and within our rare disease communities. A second observation I like to make is that within our rare disease communities, the emotional needs of our families often lag behind, for understandable reasons, the medical needs and the day-to-day needs. I like to say, I hear myself saying now that for 26 years, and I'm a psychologist, for 26 years I didn't have time to talk about how I felt about my son's situation because I was busy keeping him alive, literally. So I didn't have time. People don't have time to talk about how they feel when they're dealing with the day-to-day micro challenges that come from taking care of or being a rare disease patient. When I went to my first conference for our group, our Cure SMA group, all the workshops were about science and medicine and wheelchairs and ventilators, and there were no family support sessions. 20 years later, I'm proud to say that we've caught up, and I've been part of contributing to building a program to support the emotional needs of our families. But it is understandable and common for this area to lag behind the medical needs. I needed to make sure that my son's ventilator was working. I didn't have time to talk to a counselor about it. That's the blunt reality for some in certain situations. Over the past, since COVID, so much has gone online. And one of the pieces of good news for my profession is that although before COVID, I was able to see patients only in one state, because of interstate compact for psychologists, my license is now good in 40 states. So families around the country are able to access my services and others who have that credential who are PhD psychologists. So there have been some unanticipated positive consequences of COVID, and that's been one of them in terms of access to services. In these recent years that I've been working with rare disease communities and families, I'm seeing, as Stephanie mentioned, many more commonalities across rare diseases than differences. There are vast differences in symptoms, there are vast differences in medical challenges, vast differences in functioning. But across rare diseases, Stephanie and I were talking about this, the experience of the diagnosis, whether it takes a long time or in my son's case, 4 days, is very traumatic and very complicated. And your life flips upside down during that process. That crosses rare diseases. And secondly, the uncertainty. Living with uncertainty is a theme that crosses all rare diseases. It's hard to live with uncertainty, and all of us who are touched by rare disease have to do that in one form or another. Within communities, there are differing needs too, and you all mentioned that. The families who are newly diagnosed, patients who are newly diagnosed have very different needs than families who have been at it for a long time. When my son was diagnosed and we were told he wouldn't live very long, I was totally disoriented and scared and in shock. And there's no way I could sit up on a stage and talk about it. It took some years for that to happen. Over time, people's needs shift and change and evolve, both medically and emotionally. And now, with the advance of science, newborn screening, with treatment, there are new psychological needs that are emerging with our communities, so that families who do have treatment options are struggling with different types of challenges psychologically. Survivor's guilt is one that I'm seeing in my work, and uncertainty about whether the treatment will be durable, will it last, because there's no cohort group. So rare disease communities, as I'm seeing these miracle of science unfold, find themselves with a new set of challenges for good reason, to make space for everybody in a community, so everybody has a place in the community, so that the young mom who has a baby who had gene therapy for the same condition my son had doesn't feel guilty coming to the meeting and talking to me about their child. We want everybody to feel welcome and know that there's a place for them. So we have some new territory now. So those are just a couple observations to add on to the others that have been made. I want to shift gears now to what do we do to meet these needs? And Stephanie, you mentioned that mental health isn't only the traditional model of a mental health professional therapist with one patient. There are other ways to meet these needs, and we want to have you leave here with some of the examples of work that's being done in rare disease communities now that is exciting, that is creative, that is out of the box, and is meeting some of the needs. Maybe it's a tip of the iceberg, but we're seeing some exciting progress with using resources that are available with the help of our industry partners and with the help of our advocacy groups allotting time and resources for this important need. Tom, do you want to start with a couple examples of how Horizon and your organization is supporting mental health needs for the rare disease communities that you serve?
Yeah, for sure. So one of the areas we've put a tremendous amount of focus and effort and resources into was the easiest area, teens. Who wouldn't want to work with teens and try and figure this out? Father of a 13, 12, and 9-year-old, it's kind of like, what? Why are you yeah, okay. So that's the area we have had some, I think, tremendous success. And I'll get into what it is, but the recipe to that success really is three things. You have to have an organization that is willing, an industry, to give you creative freedom to do things differently and support. You have to have a team all the way around of from the marketing team to communications team to the advocacy team that are thinking differently, are all in these communities seeing that. And third, you have to have a willing partner. And we know that industry and patient advocacy groups can have complex relationships at times, really, really good, and it can be really, really challenging depending on the situation. So this first example I'm going to share is in the cystinosis community. We have two cystinosis peeps right there in the middle, which is awesome. Very willing partners. But this idea wasn't even mine. at Horizon, when we're focusing on rare, ultra rare genetic diseases, there's only a handful of people that work at the organization that are all in 24/7 on these diseases and think about it all day. And we have a lot of creative freedom at Horizon to engage with these communities, learn what's going on with the patient journey. And so many times teens are like, what do I do at a conference? Like, they're walking around the hallway, like, I don't, what do I do? I'm not interested in the scientific stuff. I just want to meet other kids. And in their normal life, the engagement in school and their medical challenges, they feel extra isolated, extra different. And so, and one of the ideas from one of my counterparts, two of my counterparts in communications, they decided, let's go towards artistic expression. So they found an organization that we partnered with, and they did spoken word poetry. And these kids in the cystinosis community, the last 2 years, has spent about 2 days or a day and a half in these workshops connecting with other kids that they haven't seen for 2 years and learning how to step out of their shell to merely just get in front of a room like this and say a sentence, say a poem, just say their name, but be brave and own communicating their journey while also engaging with their cohort. It's extremely therapeutic to connect with them and also therapeutic for their parents to see them express themselves in a different way. We've also done it in the urea cycle disorder community with physical art, depending on the needs of the community. We have customized it through the organization, but Horizon doesn't have much to do with it. It's about willing partners and just bringing an idea and supporting the program. And you know, Al, you were in that room this summer in Nashville with the cystinosis community, and the energy in the room was just, it was life-changing.
Yeah, for about 20 years I've been facilitating support groups for children with SMA, and for all these years I would look at my partner and say, I wish somebody else could hear what these kids are saying. You know, every year, Dr. Al, how can we get our parents to stop worrying about us? And the girls giving each other advice about how to deal with a middle school dance when they're in a wheelchair. But it was behind closed doors. I came to the Cystinosis conference as an invited speaker. I was honored to be invited, but I hadn't had exposure to the community, and I walked into the room to case things out, and the first thing I saw were these kids on stage in front of the whole room, more people than here, twice as many, and their parents, reading poetry, reading their stories, and sharing their stories. It was very, very powerful and very, very therapeutic for them and for the families who got to hear what I usually hear behind closed doors. So it was an example of a really cool and creative program that helped everybody in that community with their mental health. Thank you, Tom.
Yeah, for sure. And I think to put a cap on that, as Stephanie said, it doesn't have to be traditional sitting across the couch. It's just connection, it's engagement, it's knowing you're not alone. It's just expressing yourself. It's gaining courage in who you are. Maybe someone is a little bit more timid because of the journey they've been through in their life, and now they're able to step out, and how much growth can happen from that engagement. Yeah. So
thank you.
It's amazing.
Thank you for the example. And Wendy, we were talking just before this about a different approach that your company's taking to a step towards meeting the needs that we're identifying. You want to briefly talk about that?
Sure, thank you. So we have, first of all, that's amazing work, Tom. Thanks for sharing. We have just two quick examples of trying to drive from a research, science-driven perspective why this work is so important and why we need to pay attention. And we're doing a project in one of our neurological conditions around mental health and a specific form of therapy and why that form of therapy works better or for most people with this condition. There was some foundational work done in cystic fibrosis, so we're also trying to drive the connection around, can this be applied to more than one rare disease experience? And the work is focused on patients and caregivers within this community, and we're partnering with an academic institution to actually add that credibility and validation of the data. And it will be presented at a major neurological meeting coming up, a medical conference. So again, just trying to pull that story full circle of these patients and families really need this type of attention too. And then the second area we're focusing on is actually siblings of rare disease patients. So we did a study, and not a formal textbook study, but we partnered with Rare Revolution and we pulled together communities to actually ask specific research questions of siblings. And the data are so compelling that the impact on their mental health is as significant as patients and parents themselves. But there's also a lot of positive data that came out of this, and these kids are more resilient, more tenacious, more empathetic, and more aware of the world around them than other kids who aren't growing up in a rare disease family. And being able to share that positive data with the parents of, you're so worried about like the Jacks of the world and the, getting through every day, and you have other kids, and there's this guilt associated with them. I'm not giving them everything they need. But there's a lot of positive impact they have as well. And the verbatims and the testimony from these siblings was mind-blowing. But the number one thing that was consistent among age groups was they want transparent, honest, candid information. And they hear everything that's being said that you think is behind closed doors or whispered. So they're much more comfortable with this transparent information, and they want to feel safe to ask really hard questions. And the number one question they had is, what am I going to do when you're gone, Mom? I know I'm going to be responsible for my sibling, and this starts at a very young age. So the next step of this work is, how do we really assess what parents need to have these conversations with the siblings?
Yeah, thank you, Wendy. And thank you. As a dad, I appreciate the attention to siblings, and we all see in our rare disease communities the impact that a rare disease has on our siblings. And your research just described my daughter. She's a lot like you just said. And in terms of transparency, in complicated situations, parents often ask me, Dr. Al, when should I tell my child blank? And the answer is before somebody else does. And with the internet now, it makes it possible for kids to learn a lot of things, and other people might tell them before you do, so you want to get ahead of the action. Gary, when we talked about strategies for supporting rare disease communities, I was struck by your phrase, the power of community. Could you talk a little bit about the power of community and how that helps the needs of our mental health?
Yeah, absolutely. Thank you for that. When I think of the power of community, I think back to a movie, right? I think back to Castaway. Do you guys remember that? Mm-hmm. Tom Hanks, right? He's left on an island, and after a while, he finds a volleyball, turns it into, what was the name? I forget the name, but who? What?
Wilson.
Wilson, that's right, Wilson. And he starts conversating with Wilson, the ball, and that was his buddy. As people, we are social beings. And part of, I think, the mental component that we suffer is basically isolation when we're living with a rare disease. So few can relate or give empathy, right? And so what can we do to help solve or put a plug into the gap? I really believe we need to think outside of the box. 2015 was my first time at a Global Genes event. I was brought here by a good friend of mine. She wanted me to start the gout support group, and I'm like, where do I start? What are you talking about? What can I do? One person. I went to the event. I believe it was in Irvine, that event. I was, transformed, and I was jazzed, and I went home, and I'm like, I'm gonna do it. I'm gonna take the first step. And I think our group is unique, and maybe not so. We provide the opportunity and the chance to have community. All over the United States, we're overseas, we're in Europe, we're in the Philippines, we're in Africa. The internet has no end, right? You can reach. I remember somebody telling me in 2015 at this conference, they said, Gary, if you're going to start a group, it would be great help to have a medical professional as your partner, but it's going to be tough, right? And I'm thinking, okay, so if it's tough to get a medical professional, how much more, how harder would it be to get a psychiatrist to be on the team, right? But if we let that hardship stop us from moving forward, we're not going to get anywhere. So we have to think outside the box. And I think, you know, what we're doing here, you guys are trailblazers. You're here because you have a passion and desire to make changes. And it requires you to make that first step. Create an opportunity for people to connect, for people to experience empathy, for people to have a chance to be heard. That is the power of community.
Gary, thank you.
Power in numbers.
Thank you for that. And in the spirit of thinking out of the box, I'd like to turn to Stephanie. Stephanie and I have been comparing notes about how we as mental health professionals are meeting the needs of rare disease communities. Over in the UK, Stephanie, it's a different country, but you and I have been doing similar kinds of work. Can you offer some examples of how very thin amount of resources are spread to meet as many needs as possible? Examples of programs, support, and approaches that you take in your work and your group takes in its work that speak to this need.
Absolutely, and I think in the kind of spirit of community, one of the things that we support very much at Rare Minds is also peer support. So one of the projects that I've been involved in with one of our patient organisation partners is to train and supervise peer support leaders. So the reality is that coming together in itself and being part of a community and a support group is very therapeutic in itself. It doesn't necessarily need a mental health professional to be present, but as a peer support leader, so someone who is facilitating these support groups, but also in many situations living with the condition yourself, is that you might need some guidance on how to set up these groups, how to manage them, and then how to manage your own condition and doing this work. So that's one of the projects that I've been involved in, is training peer support leaders on feeling robust and resilient in creating these groups and running them, and knowing when to also step back and look after their own mental health. So I think that's sort of one of the ways that we work with our patient organisation partners. And if I can just add a last bit that I wanted to say is that I'm aware that maybe some of you here in the audience are maybe from very small organisations, or perhaps you're just starting up, and the idea of creating a big project to address mental health might be quite daunting. It might be very far down your list. And I just want to say that the mere fact that your organisation exists is in itself a huge therapeutic advantage for your community, because you're showing that there's more of you here and that you can come together and there's a safe space for you.
Thank you, Stephanie. You know, the first experience we all have when faced with the challenge of rare disease is the feeling of isolation and being alone. And I know in my own case, I said this morning, I launched into outer space one day when I was told my healthy baby wasn't going to live more than another year, all by myself in outer space on a planet that nobody else understood. So to be able to make connections with other people who were also launched into outer space made a huge difference to me. And that community of SMA families I consider an extension of my own family all these years later. We've all stuck together. There is power in numbers. And as a mental health professional, I'll share with you that conversations like this one, in conferences like this one, where people who have shared experiences are together, is good for our mental health. The group that Tom described in Nashville is good for everybody's mental health. The groups that we have for our kids at our conferences is great for their mental health. And now with the advances of the technology and the use of Zoom and the internet, Stephanie and I were talking about the power of the simple webinar to provide information to families, and having Q&A at the end of that kind of webinar impacts many people. I'll be upstairs tomorrow morning, it'll be 800 people on something like this around the world. Support groups, online support groups are increasingly common, and as a mental health professional, more of my working hours are now spent facilitating and being with groups of people who have a rare disease rather than one person at a time. And I'll go on a Zoom and there'll be 12 people from 10 different countries online, and they feel so hungry for connection and so grateful for the opportunity to be connected with each other, to share this unusual experience and have the support of a mental health professional if that support is needed. As Stephanie mentioned, many of your organizations have mentoring programs, peer support or mentoring programs, and willing families who were supported when they were new at this and want to be available to help others who are new at this. But they're not mental health professionals. And this is where I find myself, and Stephanie has, in a position of supporting that group of rare disease patients or family members who want to feel confident and equipped in managing the needs of others who are new. So we offer training to groups of people in rare disease organizations who are in that role. There is power in numbers, is my point. And I think it's important, as we're thinking out of the box, we are percolating on how do we find more mental health professionals who will take an interest in rare disease. And while we're percolating on that big problem, we're thinking out of the box and providing services as we can to groups, both because it's more practical, it's financially more sensible, and I can tell you there's power in that group conversation for everybody involved. Everybody benefits when they're together, whether they're in outer space or they've gotten used to outer space. People appreciate the contact with somebody else who is facing something so unusual. Thank you. The way the time goes fast, there's a little clicker here counting down on us. We're down to 4 minutes, and I want to finish up our presentation part of this and open this up to questions and conversation. I'm sure there's about 50 questions. We'll have time for 2 or 3. So let's open it up to questions now, and thank you for your rapt attention. Somebody has
No questions?
There's one.
Hi. I was thinking about what you said about sometimes when I'm a healthcare provider in a way, when you approach someone going through a hard time with the idea of getting mental health services. And like you said, sometimes it's just not in the reality. They're so busy, there's literally not the time in the day. And I've had that said to me many times, like, mental health is the last thing on my mind. I have more than 24 hours a day work taking care of my child or whatever it may be. And that's very valid. And as someone from the outside, I don't feel comfortable pushing my agenda on them when I'm not living their experience, right? So I'm just wondering if you have any suggestions that if you are met with that response, what can be a supportive thing to say? What can leave the door open for future engagement with mental health? Like, how would you have felt supported if there was a time where you said, I just can't do this right now? And, that's...
If it's okay,
Sure.
I'd love to answer that question. Thank you for that. One of the things that we do at Rare Minds also is work with healthcare professionals to kind of sensitize them to the fact that actually they're dealing with people, that more than conditions and bodies, it's people with thoughts, feelings, families, all of that. And actually part of that training is also to remind them that how powerful it can be just to ask, how are you doing? And that question alone just can show some compassion, show some empathy, but also I think, hopefully to what you were saying, shows that the door is open, that it's okay to talk about this, that there is space, if possible, in your challenging life to think about that question and start answering it. And it may be that that's not the time and place for it, but that might stay with them, and at a time where it does feel that things have calmed down a bit and they have that capacity to think about it, that they're able to reach for some support at that point.
Yeah.
I worked on a project once, and this was a key theme of there's absolutely no way we can add distinct mental health services to our already complex care routine. And we it was a focus group of about 45 caregiver moms that all happened to be moms. And we did a journaling exercise, and there were key points in time that created even exorbitantly more mental health challenges. And they were very describable. So one was school transition. So particularly if a rare disease child was going from the elementary school to the middle school and just having to navigate that whole experience as a caregiver. Another was the annual comprehensive care visit with the one specialist in the country that treated this condition. So there were specific times, and what came out of that piece of work was this opportunity to journal around those times, plan a little bit for them, and maybe seek support specifically at those. So it wasn't as overwhelming as add this to your regular care routine. It was a really fascinating approach to think about. You have so much on your plate, and then you have these points in time that add even more. How can we support you through that time period?
Yeah. For me, this is part of this is extending an invitation rather than an expectation. That's one. Two, as Stephanie said, at a given point in time, anybody in this situation may or may not be ready to talk about it or to receive help, but they may be in the future. So that invitation rather than expectation is an important concept. And another thing is that because of the technology now, there are ways for families to learn and to get exposed to support without necessarily actively participating. The fact that this particular session right now is being recorded, live streamed and recorded. Families like ours don't have an easy time getting places and don't have I couldn't be in a certain place at a certain time for a counseling appointment most of those 25 years. It wasn't easy. So to be able to record and have somebody be able to come back to it when they're ready is a good thing. And third point is many of the support groups I facilitate include family members who aren't ready yet to actively participate. So I make it very clear that families can come and go as they please and also can keep their cameras off and their microphones off or on as they please. And there may be an individual who's watching and listening and benefiting from the exposure, like sticking your toe into that swimming pool that you're not ready to jump into. But then in the fourth or fifth session, they'll turn on the camera or they'll turn on the mic first. So there's incremental steps towards the exposure for some people. Everybody's different. Others jump right in. Some need time. So I hope that helps as another response to your question. It's a great question.
You briefly touched on sibling support, and we are finding that a huge need in our community. Siblings feel unheard or like they're not getting enough attention or overwhelmed with the thoughts that they're having from the things they've overheard from their parents. And we have talked about starting a sibling support group in our community. Would you recommend us having an older sibling facilitate that, or maybe some type of a training through your leadership program where you could train them to lead the group? What would you recommend for us to start facilitating something like that?
Do you want to?
I wonder if you might be a better place
sure.
to answer because it's a US-based question probably.
Oh, sure. In our SMA group, we have siblings who are young adults who have the skill set to manage a group because they're a teacher by profession, for instance. So depending on who you have available within your community, you may have people with the training and the skill set to manage starting a sibling group and continuing it. And certainly a sibling will be credible to other siblings because they've had that experience. In my experience, some rare disease organizations have the right people, but they need a little help structuring. How do we start? How do we structure it? How do we organize it? How many kids? The space, and if it's online, how do we do that? So sometimes the person who's brand new needs a little guidance and coaching from somebody who's done it before. So I think I've seen different variations of this. I can tell you that the siblings are grateful, and the parents are especially grateful that their kids have attention, and when it's an in-person conference, that there's something for the siblings more than just the child care room for them to have a meaningful experience together.
I'd be happy to connect you to a couple of patient advocacy groups that have done a lot of work in this area that, you know, have organized communities, and you could compare notes on what's been successful and what they've learned. They'd love to help you.
There's also a group outside of RARE called the Sibling Support Project. You can glean some learnings from them.
Yeah.
Okay, great. Thank you, Al. And, oh, sorry, were you going to say
No,
something?
I was saying hook.
Oh.
You're giving us the hook, Shelby.
Yes, thank you, everybody, for joining. I know that Global Genes is really committed to the rare community and mental health as well, so hopefully we can continue to offer some support and guidance on some of this work as well through the Global Advocacy Alliance and other initiatives that we have. So this session is over. Thank you, Al, and everybody on the panel.